And then carrying on a conversation is also more distributed around having more difficulties because of the social and pragmatic aspects of that. In terms of physical health, some of the indicators we asked about in terms of physical health, we asked about weight and height according to parent report. And using that, we were able to extrapolate BMI using criteria for the Center for Disease Control and group them into underweight, healthy, or overweight, obese. And it's a bit tricky because there are different categorizations based on age or gender at different parameters. But at our first examination of this, 10% would qualify with underweight, 57% with a healthy weight, and then 33% is overweight or obese. And now we haven't yet, I'm sure people are just waiting to ask me, well, what are the differences among these groups, or between these groups? And we've just started to look at this, so I can't actually talk about that too much yet. But I know there's interest in that. Rob is very interested in that, and we're starting to look at this and in more detail. We asked parents to rate the health of the child, and actually this was just on a 4-point scale, one that was used from the UK in the work by Eric Emerson and others in terms of getting parent reports. And most parents reported that their child's health was good or very good, but at the same time 34% of the sample had one or more recurrent health conditions that required regular ongoing care. And we're right now coding the open-ended answers to this to see what those were when they endorsed that item. But on quickly looking through the 510, it's clear that the most common ones seem to be a heart condition of some sort, asthma, seizure disorder, and diabetes. Those seem to be coming up over again, and we'll be able to report on the frequency of those shortly. But it'll be very interesting to explore. This is what I mean also, is this the percentage representative of all youth with intellectual disability in Canada? I don't know, and this is really a subgroup who are in Special Olympics. But we can still look at the relationships between, for example, having these health conditions and other outcomes of quality of life and well-being within this sample that can tell us about that relationship. So it's still a very interesting and important way of looking at data, although it might not be representative of everybody across the country. In terms of child diagnosis, now this is parent-reported child diagnosis. These are not mutually exclusive categories, but around 89% endorsed intellectual disability or global developmental delay or developmental disability, because we know across the country in terms of what parents are provided with in terms of diagnostic labels can be very specific or might be very broad. So we've kind of factored that into how we ask parents about diagnoses. 41% of the athletes also had or were provided with a diagnosis of an ASD of some sort, which is higher than I expected for this for this sample, but is interesting. And again, some of the data that I'm going to present to you from this point on actually looks at those athletes with an ASD from those without, because within this sample we can still start to look at comparisons, if the sample's large enough, of ideological groups, for example, of diagnostic categories, even though, again, it might not be representative. 28% have Down syndrome, and then we see other rates of conditions. A large group have other syndrome or diagnoses other than what's listed here. And again, we have to go through those and now recode them to see which ones would fit with above or with some of these or with other categories that we fail to ask specifically about. In terms of the differences between ASD and not, so everybody has an intellectual disability in Special Olympics, but of the group that also has an ASD, there were no differences in the age, but they were more likely to be male, which is not surprising with the ratio, the 4 or 5 to 1 ratio, male to female ratio that we find in ASD. So here we found 78% of the sample have, the ASD group were male versus 58% of the non-ASD group. There were no differences in activities of daily living in terms of independent ability to perform activities of daily living between the two groups. and we used a scale that you'll see coming up, a free research measure from the Weissman Center for that. Parents of youth with ASD reported higher intellectual functioning than parents of youth without ASD, but parents of youth with ASD also reported less socio-linguistic competence than parents of youth without. So although, I think that's an interesting difference between the two groups. In terms of some of the measures that we used in the SPI-ID survey, again, we were interested in negative outcomes, but also positive factors. So we've tried to measure positive youth development, and I'm really interested in this construct that comes out of the work of Richard Lerner and others around in typically developing adolescents. And it asks about it, and you'll see the items that we've asked about next, but we really wanted to, so we used the same items on those parents that are used in the 4-H study of positive youth development. And it's been used again, and there's some real validity to that in the general population, so we wanted to use it in this one. And now, are rates similar or different to that? I think it's an interesting thing to look more into. We also look at emotional and behavioral problems using the strength and difficulties questionnaire, which is commonly used in this population. And what's nice is that it does give some clinical cutoffs, as well as I mentioned, the Weissman Center of daily living skills for adaptive behavior. And Masaryk and Paul Shattuck and others have developed a small social and language ability scale that's very useful for research purposes, and not necessarily for planning or programming purposes, but if we're looking for things to correlate with, it does give us at least some precedence there. And again, it's more than just the child. We were interested in external strengths, so we asked a lot about the quality of the home, the school, and the community environment through the participation and environment measure by Koster and others at McMaster, which gives us a nice indication of the level of involvement in those three domains of home, school, and community, but also the level of support or the degree that youth are presented with barriers to involvement in those domains. So it gives us an overall indication of quality of support that's available to them. And examples of that might be after you're given a list of activities at home or at school, parents are asked, what are the kinds of things out of this list that follows that help your child or get in the way of your child doing these kinds of activities? And it might be things like sensory issues in the environment, or the distance to travel to the environment, or the lack of physical resources or financial resources, for example. So different elements of that can be endorsed. So in terms of positive youth development, here are the 6 items that we asked. And what's really interesting is that this has come out of the literature on developmental strengths. And I like this idea of something that I think we need to do more work. Elizabeth Dykins, back in, I think it was the 90s, actually wrote a nice review article saying we need to be focusing more on positive aspects of intellectual disability, not just solely kind of looking at this from a pathology model. So this is inspired by that. And what the PYD elements are, there's 6 C's essentially to positive youth development. And I like to joke when I give these presentations that if you come up with another variable that starts with C, you can add it to this. Clearly, they're very interested in variables, only C-related variables. So what are the 6 C's of positive youth development? It's a framework rather than a specific, only one way to measure it. But they talk about competence or development as competence being the first stage, which is defined as a positive view of one's actions in domain-specific areas, social, academic, cognitive, vocational. And the item that asks about this is to rate on a Likert scale the degree to which my child has the skills to succeed in school, in social situations with friends and adults, in play, and at home. My child knows how to behave and does what is needed to do well. So the idea there is a global assessment of competence across domains. It's meant to be across rather than domain-specific elements. In this sample, 47% of the parents, it's on a 5-point scale from strongly disagree to strongly agree. The middle, the middle point is neither agree or disagree, so it's kind of mixed. But 47% endorsed agree or strongly agree to this item. Confidence is the next C, an internal sense of overall positive self-worth and self-efficacy, global self-regard, as opposed to domain-specific beliefs, is their idea of confidence. And you can see here how it's described in the in Learner's 4-H survey. Again, it's about a global assessment of the child's confidence in their ability. Okay, there we go. So 57% of the sample of the parents agreed or strongly agreed to that the child has this, the belief to succeed and to do well in the family or school. That is their self-confidence, essentially. And here's what's really interesting is that it continues along the dimensions. And I don't think we ask or try to measure these enough when we're thinking about wellness. But the next one is connectedness, or the relationship aspect, positive bonds and that the child has with people or institutions. Does my child have positive relationships with parents, siblings, other family members, friends, teachers, coaches, mentors? And 87% of the parents agreed or strongly agreed with that statement, right? So very interesting. I didn't have a hypothesis about the degree that would agree with this, but I think that's quite telling. I think it's encouraging in some ways that there are these positive connections in their lives. Sure, we can't zoom in specifically and say who are these with, but that's not the point. It's meant to be overall. The philosophy behind this, or the theory behind positive youth development, is that it's critical to have these elements, not necessarily these elements with everyone to the same degree. The next C is caring, so a sense of sympathy or empathy for others, and you can see here that 75% of parents endorse this item as agree or strongly agree. My child cares about other people. He's concerned with what others need. He shows sympathy, empathy, right? Again, do we talk about this enough in terms of the positive elements? Maybe not. Maybe it's something we can actually measure better and focus more on. And lastly, of the 5 general C's is character. So respect for societal and cultural rules, possessions of standards, a sense of right or wrong, integrity. So my child knows what is right and wrong, does the right thing. My child's open to others' perspectives. My child's honest. Now, arguably, we might say that some individuals with intellectual disability, in terms of some of these elements, well, maybe they can't demonstrate these because they have an intellectual disability, but that's an empirical question, right? I don't think because they have an ID, we necessarily want to just say it's not an important question to ask. Let's ask these questions and understand and get a better sense of what it means to show character or caring or connectedness. This is the first kick at the can for me to look at these variables. Now, those 5 C's are meant to lead, theoretically, Lerner says, to thriving. That's the ultimate kind of development of having these positive characteristics. Thriving is described or operationalized as one's contribution to themselves, to others, and to the community. And now this has to be developmentally contextualized, of course, because we can't expect a young child to demonstrate the same contributions to the community as an adult. But the whole point is that this should develop and change over time. My child tries to do things to help the family, to help neighbors, to help the community. My child tries to also help himself or herself by doing things. So these are different kind of elements, and 63% agreed or strongly agreed. And we can look at the different relations between how parents endorse this and things like age or gender or social disadvantage or the other variables. Now that we're asking these questions, we can start to look at what's related to this. So now what about ASD? This was because we have that large sample of 41% have an ASD diagnosis. As an example, what are there differences there? And indeed there are. Youth with ASD, according to parents, demonstrate less competence, less confidence, less caring, and less contributions or thriving than parents of youth without ASD in terms of the endorsements. There's a marginal difference in terms of connectedness and no difference in terms of character between those two groups. If you take, and those 6 C's are highly related to each other at a correlation of about 0.7 or above for all the items, so highly related to each other. So we can create like a mean of the 6 C's. Oh, sorry, the mean of the 6 C's is highly related with the individual items at 0.7 or above. So, you know, just having an overall average of those 6 C's, what's interesting is like their overall positive youth development is negatively related to their emotional problems and their behavioral problems. So the higher parents endorse positive youth development, lower they're endorsing problem behaviors and emotional difficulties, right? So this is an example of when we ask these questions, we can look to see how these very positively oriented elements are related to other aspects. In terms of the sample, in terms of the negative outcomes on the strength and difficulties questionnaire, we can see here the rates that have normal or non-clinical or borderline or abnormal. These are the categories prescribed by the strength and difficulties questionnaire, and you can see the rates that about 35% have borderline or abnormal levels of emotional difficulties. Less than that, 26% have conduct problems. 42% approximately have clinically or borderline levels of hyperactivity. Even larger group have issues with peer problems, but at the same time, many individuals show very pro-social behaviors as well. Now, this is the same scale that others, especially in the UK, have used in their large surveys. I'm talking about the work by Richard Hastings, Totika, Emerson. They've looked at this and published rates for individuals with intellectual disability, with and without ASD, and these rates are a bit lower than in a number of elements to what they report. Again, that might be because of the non-representative nature, that these are all individuals engaged in Special Olympics rather than solely a whole community snapshot, but it still gives us ability to look at, even within this group, who has these clinically significant levels and how do they differ from those without. So, for example, in terms of those with ID alone or those with ASD and ID, as is shown in other studies, those with an ASD have significantly higher, or there's a significantly higher proportion of individuals with ASD with clinically significant levels of emotional problems, hyperactivity, and as we would expect, because of the social and communication difficulties with ASD, peer problems, than the ID group. So you can see here the rates for both of those when we break them up by diagnostic classification, that about 45% of the youth with ASD have clinically significant levels of emotional problems, almost 60% hyperactivity, and such a large proportion have peer problems. Now let's also look at a bit in terms of what's interesting is that these are, I did not expect this, but we asked parents or caregivers, how important is physical activity or sports for your child? This is a Special Olympics group. I was expecting everybody to say important or very important, frankly, but we've got a bit over 20% that are saying it's very unimportant. This is really not important for us. And we use this scale that was used in the literature on typically developing individuals in sport. So there's a varying level of importance in terms of involvement, I think, in Special Olympics here. You can see here in the last 12 months, the proportion, I don't know if you can see my mouse, sorry, you can see my mouth, but my mouse here, there's a substantial group of about 25% who in the last 12 months participated only a few times a year or never in Special Olympics. So even though they're on registration lists, we have a varying level of participation from several times a week to never. And let's contrast that with their involvement in other types of community activities. We see a larger proportion involved in other sports, so non-Special Olympic sports, but still a large group that participates once a week or several times a week in other sports. Now here's what's very interesting. We asked about academic and leadership activities. This was also taken from Lerner's 4-H study of positive youth development. And 80% of the youth have never, in the last 12 months, been involved in academic or leadership activities. About 58% were never involved in performance or fine arts. There is a group that is involved in those activities. A large proportion were not involved in community organizations or vocational clubs. So it goes to show in terms of the actual aspects of involvement in other activities, it's quite varied, but there's a large group that is not involved in other types of activities. They're involved in Special Olympics. So they're not highly involved in everything. Most athletes start getting involved around 12 years of age, so they've been involved for a while. And just to show that most are involved at local and regional levels, they don't compete at national or world games. Very few go at this age to those elite levels. And 52% participate in non-Special Olympic sports kind of events, like banquets or fundraisers. I'm very interested in that, like going to your local community Christmas party, for example, those kinds of events. It's more than just a sport organization, evidently. So I'm going to end with a couple of regressions, because I love numbers, as you can tell from this presentation. What leads to problem behaviors and or emotional difficulties, and what leads to positive youth development? So what I've shown here is a regression where I looked at a number of different variables that I've talked about so far. Diagnosis of ASD as one, for example, is that predictive? And the answer is yes. Age of the child, gender, independent living skills, sociolinguistic competence. So individual child characteristics, we can say, are those related to having emotional difficulties overall on the Strength and Difficulties questionnaire? And when we look at these things all together, the answer is no. What is predictive is, as I said, having an ASD diagnosis is predictive. Shouldn't be surprising given the data I showed before. But also, remember that participation and environment measure I mentioned that asks about the home environment, the school environment, and the community environment, and the level of supports that are available to youth. And that across this whole sample, the quality of the home environment and the quality of the school environment and the environmental supports available in those environments is negatively related to the presence of, or the severity of problems, problem behaviors, emotional behavioral problems in youth. Very interesting when we start to look at individual child factors and contextual factors. The contextual factors seem to come out as being very important, along with some of these additional issues like having ASD. And I ran what's called a multiple mediation model. So we're looking at how do some of these variables actually explain that ASD relationship. We know that having ASD increases the likelihood of having problem behaviors or having total problems, and that's what we found here too. But what you can see from this larger model is that why is it the case? We try to say, how does activities of daily living, competence, and these supports, do these things explain that relationship between ASD status and total problems? Can we use those to actually say, is it that having ASD, for example, decreases the likelihood that you will have environmental supports, and then that's why you have problem behaviors? Looking for explanatory aspects. And what's interesting about the results here is that ASD status, or having ASD, is still related to problems, total problems overall, the severity of them, and even after putting in these other variables, continues to explain some of the reasons why people have ASD. And the quality of the home environment and the quality of the school environment, they're what we describe as partial mediators, although only weakly really mediators. So having an ASD is related to having fewer environmental supports and school environmental supports, and having those is then related to having greater severity of problems. But ASD status still explains, is still its own kind of predictive variable. I hope that kind of comes across in what I mean to say here. An interesting way of looking at within this group, how do some of these other ingredients relate to negative outcomes? Now what about positive outcomes? And this is what I'll end on. Same variables, looking at positive outcomes. And what comes out? Well, in this model, what's interesting is that having an ASD diagnosis doesn't come out as a significant predictor of overall positive youth development. What does come out are your independent living skills, your sociolinguistic competence, so there are individual child components, and this really fits with Richard Lerner's model, because he says that positive youth development is related to a combination of individual child competencies or strengths and environmental strengths. And what we're finding with this data, when we see here, is that individual child strengths, so what they can do independently, their adaptive behavior, is important, as well as environmental strengths, and more specifically, home environmental qualities and school environmental qualities. I suspect, as if we were to look at this in an adult sample of, say, 21 and above, that community environmental supports would come out as significantly related. Now, here's really interesting. We rarely see this, but having an ASD diagnosis is very much